We'll get started. So, welcome everyone. Thank you for joining us today. I'm Zachary White, one of the quantitative analysts here on the research and evaluation team at Unite Us. Last year, I actually received my doctorate in epidemiology from the University of Delaware, where I worked with the Disaster Research Center on improving post-disaster survey research methods. So today, I'm really excited to bring kind of a topic that interests me a lot, to the foreground working here in the social care space. Um, in regards to that, I am honored to be the moderator for this discussion. And before we dive in, I just have a few quick housekeeping notes. So we're going to have some time at the end for a Q&A session. So as you think of a question or as our panelists are speaking, please feel free to submit those questions in the Q&A box throughout the webinar. We're also going to be recording this session, and after the session is complete, we'll share the recording afterwards with all of the registered viewers. But today, we're going to be focusing on building disaster resilience through strengthening community connection by leveraging technology. We're going to explore how technology, cross-sector collaboration, and data-driven approaches can enhance communities' ability to respond and recover from disasters, especially in ways that are centered on those communities' needs. For the panel, I'm excited to be joined by two outstanding experts who are going to be bringing some deep knowledge and real-world experience in disaster preparedness, emergency response, and community readiness. Jeff, would you mind introducing yourself?
Sure thing. Hey, everyone. Great to be here. Great to see you, or at least see a list of names in the participants column. Yeah, my name is Jeff 𝐊𝐞𝐲. I'm the director of the National Center for Disaster Preparedness based at the Columbia Climate School at Columbia University, where I'm also an associate professor of professional practice of climate. In my background, really, I started on the public health side of things and really sort of looking at sort of determinants of health, particularly in the disaster space and the health security space, and have moved more into the sort of more general disaster management space, and always with the keen eye towards populations with special needs, historically disadvantaged populations, and really sort of the social structures that make up a big part of disaster resilience strategies. So thanks for having me, and look forward to chatting.
Awesome. Thanks for joining us, Jeff. Matt, would you mind introducing yourself?
Absolutely. So welcome, everybody. Excited to be here today. Matt Hernandez. I'm a senior director for public sector here at Unite Us. Been with the company for about 4 years. Have a pretty diverse background. Both served in the military and then worked in healthcare, both involved in emergency management planning and then also COVID response. So excited to be here today and for our discussion.
Awesome. Thank you. Thank you both. And welcome to, so glad to have you guys. So before we dive into the questions around today's topic, I think it'd be interesting if you guys could both share a bit more about your current work and how you guys became first involved in disaster preparedness and response. Maybe Matt, starting with you.
Sure. So yeah, I mean, I graduated from United States Military Academy at West Point, and then I served in the Army as an infantry officer where I led troops in combat during Operation Iraqi, Enduring Freedom in Afghanistan with the 82nd Airborne Division, and then I later managed ceremonial and logistical missions for the Presidential Honor Guard in Arlington, Virginia. And then after my service, I worked at Hospital Corporation of America in a number of different roles as part of their junior military officer leadership program. And one of the things that I was blessed to be a part of was a committee for HCA on their emergency management committee, when our focus was really on hospital preparedness and what we were doing to make sure our hospitals were prepared for a number of different types of issues, emergencies, with a big emphasis on hurricane response, since I was working in the state of Florida at the time. And then I worked for Envision Healthcare during the COVID response and was part of a team who rapidly deployed telehealth solutions to ensure we had medical coverage at hospitals across the country. We staffed hospitals back then with a number of different physician groups, one of them being emergency room physicians. And so we had to ensure that we had coverage, and we leveraged telehealth to make sure that we protected the physician population and also were able to treat and triage as many people as necessary. And I think just, the combination of that, helped me really, my career's really been involved in high pressure planning, coordination between agencies and community resilience. And I've tried to apply that role here at Unite Us as well in the last 4 years that I've been at the company. So.
Awesome. Thank you. Jeff?
Yeah, so I got started in this field in kind of the post 9/11, post anthrax attack days. And so there was a huge kind of focus on terrorism. And then as we kind of went through the different things that we were experiencing, both domestically and internationally, we would see things like Hurricane Katrina, the Asian tsunami, and just a lot of these more sort of natural hazards, as well as diseases with pandemic potential. And so really got into more of an all hazards kind of space. But prior to kind of getting involved in the disaster space, I actually did my undergrad in theater studies with a minor in sociology. And I mention that because it's something where, you know, we sort of talk about these larger policy issues, we talk about these larger trends in society, and that was really sort of on the stage where you sort of explore what is the journey of the individual, what is the experience of the individual within the context of their lives. And so through a lot of the work that we do, and both I started working in public health and then in a quasi consulting and now in academia, is always if we're at a higher altitude trying to get that vantage point kind of from the individual, from the family, how does this fit in with the experience of their lives and their social connections or lack thereof? And when we're flying at a lower altitude, to elevate that experience and really give folks an opportunity to kind of elevate that voice so that we're informing kind of multi-directionally on all of that. So.
Oh, awesome. Yeah, you make a really good point about this idea that most individuals, right, have this experience with disaster preparedness or disaster response really at that individual, personal, family level. And obviously, the conversation today, we really want to focus on the community and how we can better facilitate individual relationships in those groups. And I think this really comes from more of the academic side or the practice side when we focus on this idea of a whole community. So, Jeff, would you mind explaining what is this whole community approach to the disaster preparedness and what does it really look like in practice?
Yeah, and I think this whole community is sort of recognizing these forces at play. And it's funny, and actually, Zach, your alma mater at the University of Delaware is where a lot of this research came out, right? On what are the dynamics, and it was through some sociologists who are sort of seen as the founders of the field of disaster science, looking at how or how communities respond, who are the different actors, who are the different players in the community. It's interesting until this whole community concept, which really I think was more formally introduced into the vernacular after Hurricane Katrina. It was very government oriented. It was very procedure based. It was very like, how do we get governmental institutions to organize, and by extension, how will they organize the private sector? So very hierarchical, and that's not how communities work, right? Communities are social organisms, right? They have a lot of different dynamics. They're not sort of within them, with those who have access to resources, those who don't have access to resources. Whole community also came at a point after the 9/11 terrorist attacks and the anthrax attacks where funding was at its peak. When I say it was at its peak, it was at a very unsustainable place, at least through the eyes of Congress. And so we started seeing cuts to the grants. We started to see that drop off. And I think Hurricane Katrina, taking a very sort of uh, hierarchical approach to response, generated a lot of challenges there, and some of the insensitivities to the needs, but also the capacities that exist within the community and rely on flexibility and empowerment to do that. So it sort of came at a time where there was this very in our face realization that the way we were doing this fundamentally needed to change, which happened to correlate well with the research that had been done up to that point. And also, it was the only way to really shoulder the financial approach to this too, is that this has to be part of the cost of doing business for everyone involved with the community, not just sort of a redirection of tax dollars.
Yeah, great. So this idea of, really building the onus within the community, trying to bring individuals together to make those connections. Um, and so you kind of talked about this transition, right, from the hierarchical to building out more of the base, right, where the actual event is occurring. And so Matt, I guess the question would then come to you with more of your experience being at that policy level or at the governmental level. What do you see as being the role of state and local governments in disaster response?
Yeah, I think one comment I'll just make what Jeff said. I do think he made a good point. Like, not every community is the same either, right? There's a lot of uniqueness from community to community. I think really driving public and private partnerships is important. So just want to kind of double down on what he said there. But as far as the role of state and local government disaster response, I think, traditionally we've seen government focus on power restoration, debris removal, temporary shelters, search and rescue efforts. And I think that's been the approach that we've traditionally seen across the country. And I think it's important, right? Those are things that we should be doing, or government should be doing. But I think we've also started to see, or traditionally we've seen them generally rely on NGOs to coordinate additional services like hot meals, clothing, things of that nature. And I think we've started to see kind of a shift. And when I say that, a shift in that some government organizations are kind of taking on more of a direct role and also supporting and addressing some of those unmet needs, right? So really doubling down on those public-private partnerships as opposed to kind of keeping them very separate. We're starting to see some of them take a more proactive role in really driving those partnerships so that you can maximize the response for those that have been impacted by the disaster. So I think both, right? It's traditional things that they've been doing, and I also think it's taking that more proactive approach and really working with the non-for-profit community and even some of the public for-profit community too that has tremendous amount of resources. We've seen that in the state of Florida. We've seen that in the state of Tennessee recently as well, where they're leaning on some of the large organizations that have additional resources at their disposal.
Yeah, great. Really kind of acting as like a facilitator to prop up those locally informed organizations. So I guess, Jeff, I don't know if you have anything to add to that or if you have any thoughts on it, but is that an area that government should be prioritizing in order to prepare for those, forthcoming storms or events that we're seeing? Is that the best way to improve disaster response? Is it to address those collaborative efforts right beforehand, or is it something that they should be facilitating after or during the event?
Yeah, and obviously there's a responsibility sort of throughout, but you really want them, virtually in every equation, the more that you invest ahead of a disaster, the more you save in response and recovery. And that can be in dollars for mitigation, that can be in relationships, right? In terms of having those relationships, working out those agreements in terms of things. If you're going to have healthcare systems that are sharing patients between each other, how are you going to track the billing, how are you going to integrate logistics, all sorts of things like that. It's better to spend the time while you have it than make decisions when you don't have the time and when a lot of the details, a lot of those critical ones kind of fall through the cracks. And piggybacking a little bit off of what Matt said too, we have by any measure 80-90+% of the infrastructure for disaster resilience exists in the private sector, right? The role of the federal government in a federalist democracy is actually fairly weak. Much more of it is with the states. There's been some influence of the federal government through grant programs and through incentives. I always tell people just watch Act 2 of Hamilton, and you see where the federal government gets its power from. But at the end of the day, where that capacity a lot of times it is one of the strongest predictors, right? It's that social cohesion, how connected communities are, how connected they are with the political processes and things like that. I will say too, a big elephant in the room is the current dynamic with the current administration and a lot of the uncertainty and a lot of the shifts and pullback of the role of the federal government in disasters that's been signaled by the current administration has been affected by pullback of some grants, hesitation on some disaster declarations. Not getting into sort of all of the politics and the what ifs of that, this is a strong signal that, again, more is going to be expected of the communities, and in many cases, more is needed of these community-based institutions from all sectors. That it's more important now than ever, and it's unlikely that it's really going to reverse back to a place where, at least in this country, where there's a paradigm where you can't have that.
Yeah, that's a really good point. Is this idea that, even with shifting priorities, whether that be at a federal or a state government level, there is always going to be this importance of pushing forward the relationships or the connections between communities and either public partnerships or private partnerships. So I guess maybe Matt, you might have some more experience with this, but how would you recommend communities start building those trusted relationships ahead of a disaster? Maybe even like, if those conversations aren't really happening yet, like how do you suggest approaching that, or what would your advice be?
Yeah, I think traditionally they've, local government, state government has worked on partnerships with the VOED, right? Those voluntary organizations that are active in a disaster. And I think depending on where you look at across the country, some of them are more mature than others. And I think that's great. I think we should take best practices across different entities that have had more experience or more examples of where they've had to deploy. But I also think one thing that we've seen in some communities too is the VOEDs are great, but there's also thousands, hundreds, thousands, maybe even more than that, of other non-for-profits and community partners and these private partnerships too that could also participate in response if you had built out these partnerships ahead of time, right? So I think Jeff mentioned earlier, once the emergencies happen, you're kind of scrambling, and you're kind of, the more things you can do ahead of time is the better off you're going to be in response. And I think if those conversations were facilitated more often, and you would tap into the resources that already are existing in certain communities, when an emergency happens, they can support that population more efficiently and more effectively.
And I can jump in. I have a specific example. I worked for a health system for a while, and it was we had a prolonged power outage, and it looked like, I believe it was a skilled nursing facility, it was about to lose power. And so it was outside of the network of this hospital, and essentially what they were trying to do, and I wasn't part of the conversation, so I hope I don't get any of this wrong. Don't quote me on it. But essentially, they spent the day sort of trying to work through. It was urgent, but the power hadn't gone out. The generator wasn't out of fuel, or whatever the cause was that was doing this, and they had essentially worked out a plan where essentially the state was involved. The State Department of Health would move the license of this nursing facility to an empty floor of the hospital, and then allow their staff to sort of work under the license and work out there. Anyway, they did that all day, and then the power got reconnected, so they didn't have to implement it. At the time of Hurricane Sandy, they thought that they had gotten everyone evacuated, and unexpectedly, a hospice facility had lost power. And we're very, very close to the 0 hour where it's too late to evacuate, where it's too dangerous. That playbook had already been written. They were able to, blow the dust off the cover. The state had already been on board, and changing the license of a facility, right? It's something that I say very quickly. It takes a while to work through the details and make sure that that's legal and everything. Those are the kinds of things that had already been worked through. And so they were actually able to have a very effective last minute evacuation, in part because this relationship between the state and private entities, that the playbook had kind of been developed and already been worked through. So it was just a very, very specific example on how that paid off in a more urgent kind of disaster setting.
Yeah, I think you make a good point, right? That obviously at the beginning of the day, everyone wants to say, we're ready, we're prepared, we were building these connections. But as you said, like those details take time, they take resources. And so I guess my question to Matt might be, what are some of the common challenges in sustaining those partnerships? And like, have you identified anything that has allowed communities to effectively address those challenges in building the partnerships?
Yeah, I mean, I think disaster response in itself can be extremely stressful and challenging, right? So having redundancy, or as much redundancy as possible, having a strong bench to pull from, and as many reliable resources at the ready who can support when needed is helpful, because the response can be daunting, right? It's taxing on people, it's taxing on families, even the ones that are actually responding and doing the work to help people who've been negatively impacted too. So I think having as much redundancy and as many resources available to pull from is important. One of the things that we used to plan for in the military that we also applied with some of the HCA planning was, when you think about disasters or any kind of scenario that you want to plan for, if you think about what's like the most likely course of action to happen and what's the worst thing that can happen, and we have plans for both of those, we can figure it out in between, right? But you need to have resources to pull on, as Jeff said, like blow the dust off the cover if they've already gone through some scenarios and done those rock drills and those planning sessions. That's important. So I think having as much redundancy, not only relying on the one or two faith organizations you've always relied on, having more of a bench is important when you think about resilience and response and sustainable of those partnerships. And a good example is last year, Florida got hit by 3 hurricanes, generally in mostly the same region, right? The west coast of Florida got crushed by 3 different storms in 1 calendar year. And I mean, that's pretty taxing on the folks that are consistently responding. And so as an example, I think just having enough folks to rely on is helpful when you think about sustainability.
Yeah, yes. Thinking about this idea, right, of sustaining those partnerships and being able to, Jeff, have you seen anything in the communities that you've worked with that has really allowed for them to build those stronger connections and demonstrate stronger resilience in times of disaster?
Yes, but I think that this is one of those things, and to kind of answer your prior question and leading into this on what are some of the challenges? There's not enough time, there's not enough money, and we don't exactly know how to do it. Other than that, we're good to go. It's every community is different, and a lot of times you'll get a grant and you'll get seed money to do something, but if you design it in a way that's very dependent on that short-term money, when the money's gone, the program is gone. We did some work with funding from GSK on our Resilient Children, Resilient Communities initiative that was designed in a way to kind of integrate the work into existing workflows. So was it the local emergency planning council in one area? It was they had this committee that had been set up that this became an agenda item. And so a lot of times we're looking at what is the current sort of currents, right, through the community, and are there ways to sort of help foster those connections around work streams, around funding sources that are more sustained, where this can serve as sort of an impetus to catalyze some of this. And we saw this where we helped work to kind of foster these coalitions, in this case, between the child serving infrastructure and the emergency management and emergency response infrastructure. And nothing made me happier than during COVID seeing them posting on Facebook how they were like helping collect things for childcare providers to help sanitize their areas and things. And we were on a call where, one group, the diaper bank was on and emergency management was on, and they were saying we're having trouble, or maybe it was the Red Cross, we're having trouble getting supplies for newborns, for parents. And then they said, literally, the person who was representing it was in front of shelves full of diapers and said, I'm going to give you a call right now. We've got plenty to give you, and do it. And so to me, those moments are seemingly forgettable, but those in aggregate actually represent a more resilient, more connected sort of sectors within the community. And it was, again, really about sort of paying close mind that while this project was temporary, how do we embed it within structures and processes that are actually built for sustainment? And talking about technology, because I know that's a big theme for today, we see this pattern with technology as well too. If you introduce a new technology, it's hard to get people to adopt that. But if you can get them, there are folks who are working with in refugee communities, and it was WhatsApp groups and Facebook groups. This was maybe 7, 8 years ago. And those were dominant technologies that folks were using, and they were trusted. They knew how to use it. It was a natural extension from what they were already doing. And so finding those pathways that already exist and augmenting them a lot of times can be much, much more sustainable than trying to create something totally new and then backing out and seeing if it stays standing.
Yeah, awesome. Yeah, and great segue. I do just want to take a quick second to pause and just as a reminder to any of the audience members that are currently with us, please feel free to submit any questions that you have in the chat, and we'll be sure that we get to those at the end. So Jeff, you're talking about the use of technology, facilitating those relationships, being that driver, the connector. I think something that we also talk about is this idea that we live in a world that's just so full of data, right? Like there's data ever persistent. So I know that I'm sure you have a different idea than maybe a technology company would, but maybe this is to both of you really, is like, where do you see technology playing that most meaningful role? Is it in strengthening those collaborations, or is it in identifying changing needs maybe?
Jeff, I don't know if you want to answer first. I think it's both. I think identifying needs and trends is important, and then also using technology to collaborate around addressing people's needs is also significant too. One of the things that we've started to see, I mentioned that trend earlier about addressing kind of the unmet needs. Having, you can use technology to have a common system that allows for constituents that have been negatively impacted to ask for help, right? They can identify what needs that they have. They can share some basic information on who they are, where they were impacted, and if they had to move for whatever reason, be it wildfire, hurricane, tornado, if they've been displaced. Knowing that information is important, and understanding that the data, what those needs are, right? So what kind of needs are we seeing across the population, and how well are those needs being addressed? And if there's any gaps in resources, can we shift resources there? So having a system that allows for collaboration, communication to occur, and really to track the data can help inform just data-driven decision-making and how to shift resources to the area that makes the most sense.
Yeah, I think there's and just sort of piggybacking on that, I agree with all that. And I think that, there's a lot of data that has led to some really great insights on the research side, particularly around social cohesion and the value of social cohesion, ways to predict that, ways to measure that. When I say social cohesion, how connected people are with each other in a community, which is actually one of the strongest predictors of disaster recovery. To be able to actually connect people, we saw this particularly during COVID, where we had social distancing, but to try to make that less of a social distancing and more of a physical distancing. Now, that was not evenly spread, right? There are a lot of people who got very, very isolated, but there were a lot of people who were able to sustain connections because of things like Zoom and FaceTime and all sorts of different technologies like that out there. And so that has a very, very pronounced effect. And then, an area where I think there's a lot of potential but hasn't been fully explored is to democratize sort of the input into disaster management. So we've seen this at times where we've seen areas that were not getting services post about it on social media and be able to garner attention. So we've seen it kind of force-fed. I have a colleague who's on the other side of this wall, that's why I pointed right now, who's doing some work with cell phone-based games in sub-Saharan Africa, where you sort of go through this game and can provide input into what the behaviors would be or the expected behaviors of your neighbor, and methodologically that gives you some interesting information than if you ask someone themselves. So it creates an opportunity to hear from the community what are the more likely behaviors in a disaster, rather than guess at what they are or try and create plans that assume or force people into behaviors that are much less likely. And then the other piece, I'd be remiss if I say this is it, and everything we do is better informed by data, but a lot of times it requires an investment and very tedious, very expensive, very boring data collection. The US Census and the American Community Survey serves as the backbone for a lot of the social vulnerability data, a lot of the disaster-related data. And certainly, too, some of the primary data collection, working in the climate space on my end, from satellite data to early warning systems and things like that, are very, very critical. And so, and that is a role that there's a lot of debate on whether to privatize or keep public. And I would say that it's cost prohibitive for many, many of these things if it's not kind of democratized, if it's not something that's made publicly available. There are by many orders of magnitude. And so I think that recognizing that this is an increasingly data-centric world, we do need those investments and the very boring, very tedious data collection to draw the insights and make the pretty pictures that we get to present at conferences.
Yeah, definitely. It's important to, have access to, again, the underlying situational awareness, right, of what's going on, who is impacted. One of the interesting things that I've found is, during these events, the needs shift, needs are changing. And so I was wondering, Matt, I know that you have been directly involved on the ground with Unitas's efforts to support disaster response, most recently, following those hurricanes in Florida. So what would you, suggest or that organizations consider when integrating these new technologies? And Jeff was even saying earlier, it can be a heavy lift, right? Into their existing disaster response and preparedness plans. And just as an additional thing, like what role does Unitas have there?
Yeah, I think I would say, to Jeff's point, like you want to have things worked out and kind of a plan put in place prior to the emergency happening, right? So you want that blue skies preparation before the disaster emergency response comes. So I think being proactive about how you want to address it, and then going through the process, right? And then refining that every year, or after, doing a hot wash after every time you've had to execute on that plan, So I think just the proactive part of it's important. I also think, what we found is you really need to build a system that enables a no wrong door approach that allows folks to get help, whether they walk into a disaster resource center, a local county, or request help from their mobile device, right? Jeff talked about using Facebook and WhatsApp. Like now that, the common times, the majority of people have a smart device or smartphone, and whether they may not have, self-service, the immediate aftermath of a disaster, they're going to get it soon. And so giving them a chance to ask for help and creating that no wrong door approach, no matter where they're asking for help, they can get it. And then we're using the system to be able to coordinate care, and then making sure that we're tracking the data, as mentioned earlier, because with the data, you can now identify, where the greatest needs are occurring. You can identify we have the right resources in place. I think one big thing we saw too is a lot of people were displaced, right? Katrina, people were displaced. A lot of people went to Houston. They scattered all over the place. Florida, it happened as well, where people were, they left the west coast of Florida because there was nothing left. I mean, I'll give a personal example. My parents live about 5 miles south of where the center of the eye came through for Hurricane Ian, and their entire community was destroyed. And so even the pre-existing organizations that would have helped serve them could no longer serve them because they were also victims of the hurricane. And so, those people displaced, they had to leave and go somewhere else for months and months, some people even for longer than that. And so knowing where the people are even displaced is important too when you're starting to provide resources of, why is somebody from the East Coast or the northern part of Florida, maybe they even went to Georgia. Why is somebody that's in a different part of the country or the region now asking for help for these kinds of services, knowing that they were displaced because of a storm or disaster, whether it be a hurricane or a wildfire, is important, right? So having that system, being proactive about, putting the plan in place and then fine tuning it as you go through different iterations is all important.
Yeah, Jeff, I was wondering if, if you have any experience. I know, like, again, going back to the work with the resilient children's resilient communities, you had some novel, indices even that you were introducing to the community to assess readiness. Do you have any experience or any suggestions to community planners or local organizations that are trying, to build those relationships still? Like, how would what are those effective ways of integrating these either newer technologies or newer measures for the goal of improving community readiness?
Yeah, and it's sort of a loose term, new technologies. I grew up in the Bay Area during the 90s in the Silicon Valley, and so there's sort of a mix. And then you may have the latest sort of AI powered app on the new Apple or Samsung phone, but then being an agency that's still working off Soviet era technology. So new is kind of a relative term in terms of what it is. But I think it's important to note that because a lot of times even as we were redesigning our website for our center, one of the things we were thinking is that there are these very flashy websites that are very popular in sort of the tech industry, but we also have a constituency that's reading ours that's coming from academia, that's looking for clear, simple, substance, but also easy navigability. And so I think that that's something really to take into account that we found along the way is what is the technology that's absorbable by the end user. And that's where we would see a lot of times, like they were already using, there was one place we were trying to develop, I forget what we were trying to implement. It ended up being a Facebook group because everyone was already using it, everyone was already familiar with it. And so for that particular community, that was the most effective, and we got a lot more engagement from that. For others, we might use something like Slack or something more specific to it and a new technology. So I think it's also worth sort of defining like what is the function and is there something that's already being used or to make that jump. And sometimes you do have to make that jump to a new technology, but just understand you're now owning a change management process, an IT change management process at a level that has a lot more sort of effort required to move. So I think that as we sort of think about these strategic initiatives and integrating technology, it's either a matter of sort of scaling or what is the next logical step, pivot point from where you're already at, or is it more of a leap into a new technology? But either way, certainly within emergency management, to the extent that community organizations are looking at recruiting and growing staff, data management, technology utilization, change management for for technology-based projects, and even GIS and mapping are all sort of emerging or established core competencies of the field now, much more so, and it's going to continue to be so going into the future. But I'd also say too that, and I see some of the questions, and I'll hold off getting too deep into it till it comes up on AI and things like that, is that there are sometimes the tool is greater than the need in terms of it. Sometimes, we try to math our way into greater precision to help make a decision for us. And that can actually lead us down in wrong directions as well too. So I'm all for technology. I don't want to sound like a Luddite, but it also needs to move in step with the ability to utilize and fully capitalize on that technology, which is at a different pace depending on what type of industry you're in.
For sure. I mean, I think everyone at this company would for sure agree that, we're trying to identify pre-existing workflows, right? That you're just trying to really improve the efficiency there. And so I think this is actually a audience question, but I think this, Matt, just to quickly go back to where we were before, like what exactly is Unitas's role in disaster response? Like how do we as an organization support communities on the ground during that crisis or immediately following it?
Yeah, I think what I'd say is, as far as like the community side, Unitas has a technology system, right? And the system allows for care coordination and collaboration to occur across sectors. What does that mean? We have across the country hundreds of thousands of non-for-profits and community-based organizations that utilize Unitas to screen individuals for needs, document what services that they're providing for them, and then provide closed-loop feedback to the entities that they're working with. How that applies to emergencies is we've partnered with a couple different entities for different types of emergency responses to build them that no round door approach that allows for individuals that have been impacted by an emergency or disaster to request help, right? Tell us who you are, tell us where you're at, or where you're from, where you're going, what your needs are. And then we've provided even care coordination services to make sure that people are getting connected to the best organization that can meet their needs, whether that's a food need, a housing need, if it's a clothing and household goods need, trying to make sure that we get them connected to services, documenting the outcomes with that closed loop. So we're verifying that their services were being provided and their issues were being met, and then providing the data back so that leadership can make data-driven decisions based on, again, what needs are out there in the community, how are different communities being impacted by whatever the disaster or emergency was, and then how to shift resources to best serve the constituents.
Awesome. Thank you. Yeah. So I think whenever we're working with a new technology, whenever we're implementing new processes or trying to identify different workflows, at least coming from the program evaluations perspective, right? We're always looking for kind of identifying what those success measures are. So I'm sure it would be different between the both of you, but I would love to hear, from your perspective, what does a successful disaster response or successful community preparedness look like? Is it measured in, the number of partnerships that are activated, the cohesion of those partnerships, or would you say that there's some other kind of measure of success there?
I think number of partnerships is important, right? Because that helps you to excuse me, to build that bench and have redundancy on the resource response that's needed. But I think it's deeper than that, right? I think identifying what people's needs are is important, but the most important thing is getting them the help that they need, right? And so whether they need, if they lost their entire house and they need to replace their clothing and household goods, it takes a very long time sometimes for that insurance, if they even had insurance, for that process to go through, for them to get money to go reimburse their clothes. And so if we had organizations that could say, hey, we identify that Matt's got a need and we're going to give him, a week's worth of clothes for he and his family, and knowing that service was provided is the most important. So knowing that if a constituent has a need, they've been impacted, they're a victim of an emergency and actually had their needs met, I think that's the most important part. So really understanding, we identify what the problem was, we served them, we solved the problem. That's the most important part.
Yeah, and building off of that too, my predecessor and mentor Erwin Redlener would call this the denominator problem, where a lot of times you'll hear organizations sort of celebrate, hey, we built 400 houses. How many do you, but they leave out how many do you need and how many do you need? Oh, 50,000 or something, right? And don't get me wrong, let's celebrate what was done. So when you're talking about measures, it does have to be balanced with an understanding of the need. And so I think first and foremost is like, what is the scale of need? And what is the effort to get there? Another is transaction time. And again, sort of alluding to I think Matt alluded to this, right? Is that, we look at things like post-disaster housing recovery with the community development block grants, and Hurricane Sandy happened in October, and a colleague of mine who worked for one of the affected states on the community development block grant. It had to go through Congress, be received by the states, get set up by the states. The first person couldn't start applying until June of the following year. This is an entire educational cycle of a child. This is you can't get that time back. And that's just the start of the process, the start of doing it. And so I think that looking at that transaction time is also really, really important in terms of what is that end user experience. Number of partnerships and things like that, I think can be helpful if it's ultimately towards creating the redundancies and creating sort of the options that can be exercised towards improving the survivor experience. But any of those measures that are divorced from the survivor experience have the potential to tell the wrong story and convince us we're doing well and obscuring what we're not doing well.
Yeah, yeah. Thank you both. This has been, a great conversation. Before we, look to start wrapping up, I do just want to give another shout out just to say, if there's anyone in the audience that has any questions, again, please feel free to submit them to the Q&A, where we will get to them. But before we close out, we've talked a lot, right? We've talked a lot about the partnerships that are being built, the idea of introducing new technologies and how they work into the workflow, really looking at both not the individual level, but also that community level. And so, since Jeff just spoke, I'll throw it to Matt, but I would love to hear both of your guys' opinions. If you could see just one major change, whether that's in policy, the partnership building aspect, or practically, what significant change would you make in order to try and improve community readiness?
I think Jeff alluded to it earlier that there hasn't been a ton of funding or any a fair amount of funding to be used for preparation. I think most of the time we see it's all reactionary. Funds are typically released after disasters are declared, and I think that's a fair process. But if we really want to become more proactive, more prepared, I think we should think about how to be proactive about putting in systems that can help address what we talked about earlier, that can help to build some resiliency. And I think if we were more proactive, Jeff said, all the data points to and all the research says that the more investment you make in the beginning, the more you save on the back end. And we've just seen that some of these emergencies and these disasters seem to be getting more and more impactful and big. And so the more that we can do ahead of time, I think the better prepared we will be from a cost saving standpoint and from the human aspect, right? If we can better serve people that have been impacted, why wouldn't we want to do that?
Absolutely. Yeah. And yeah, I guess what I would say too is that we tend to measure what's easy to measure. And that's not always the most important measure. And we also tend to fund what's easy to see, right? And not what's harder to see and harder to connect. And I say this coming from a public health background, right? Like one of the hardest things to do is to fund an initiative that has kept a lot of bad things from happening for a lot of years. So I think so to Matt's point on like the emergency management suffers from the public health problem, which is that if you do a good job, people think you don't need it anymore. So I think as we look at this and we look at things like social cohesion, social capital, I've seen research that suggests having a block party could actually be more beneficial than putting that money into preparedness kits for individuals. I'm not sure if that's true or not, but that's a debate we should be having, right? I'll bring the smoker. We can grill up a brisket. But that is time and time again a dynamic that we see as these investments in communities. And then what we come to find is you actually get outsized benefits. We keep talking about these tipping points, particularly in climate change, that have outsized negative impacts. But there's the potential for some of these investments to have positive tipping points, positive outsized benefits from a lot of this. And I think that sort of stepping back a little bit from the one-to-one, like, oh, it flooded, so let's build a higher wall, and really start looking at some of these community dynamics and social dynamics and putting some of the data behind it. I shouldn't say starting to, it's happening, but mainstreaming that a bit more and putting resourcing and funding behind it, I think has the potential to illuminate solutions that we haven't thought of yet.
Yeah, it's interesting that, I mean, again, coming back to this community cohesion, ability to measure it, right? This idea that it's, you know, preparedness, as you said, the funds can go for it, but if it's not actually building towards that cohesive response, or, you know, you help me, I'll help you, social cohesion, as Jeff keeps saying. So I guess coming back to the technology aspect of it, um, what or how would smaller or more rural communities with the, you know, arguably more limited infrastructure or more public funds to spend start building those kinds of partnerships? I know Jeff already alluded to, you know, a block party or but is there anything that you've seen that would, you know, help facilitate that?
I think with the in some ways, I guess it just kind of depends on what the different communities are and how you define community, because you can actually see very, very tight-knit communities in very rural areas because you rely on each other to survive. So you can see certain dynamics there where neighbors are more likely to check on neighbors. We can look at like rural communities in Alaska where if someone needs to borrow something or someone needs to check in on someone, and then we can look at neighbors in the Rockaways, right, during Hurricane Sandy, who, were completely and socially isolated. And then from there, also kind of looking at like what kind of what fosters that, right? What types of investments? Is it county fairs? Is it the types of infrastructure that's put in? I've seen data suggesting that community-driven social infrastructure, a cafe, a library where people come to meet, where people come to do business, has more benefit to the community than larger scale infrastructure. Again, a lot of this can be debated based on the frame and the methodology, but it's a conversation that I think we should have in terms of what are those investments that lead to it. Rural communities too, I think it's something that oftentimes they have trouble garnering the resources. And I think also community-driven solutions, if it's something that is wanted in terms of bringing in or not. But it is an area where per capita type of funding often leaves out some areas that are particularly vulnerable and would have probably need some of the assistance more than those that get it through the traditional formulas.
Yeah, Zach, just to double down on Jeff's point, I think there's a term we use at the military and also like EMS world about mutual aid. Mutual aid typically is like a contract, at least the EMS side of the house, where, hey, if if neighboring cities, counties, municipalities don't have all the help that they need, that they would come to each other's mutual aid, right? And typically that's a contract. I don't necessarily think it has to become a contract, but when you think about more rural settings, if there were those conversations or those partnerships were being extended from community to community. And I also think states have some obligation too to support the communities that that operate as well, and that they know that may be less inclined to be able to respond to things. So I think just having those partnerships and those conversations and supporting each other is important. And I think, if you had systems that could help to aid in that coordination and collaboration across the region, municipality, county, parish, you name it, I think we'd be more successful.
Yeah, definitely. And I mean, as Jeff alluded to as well, right? Those partnerships are both formal and informal. So thinking about mutual aid coming from EMS myself, like those are very formal established agreements, right? But maybe thinking of like rural Appalachia during
Right.
Hurricane Helene response, right? That was a very tight-knit group, but a lot of informal mutual aid, like neighbor helping neighbor. Um, so I completely skipped over it, but I was able to, these are really the audience questions. It might be like we're jumping around here, but just to come back a little bit to this technology, and Jeff already talked about it a little bit, but AI. So an audience member asks, can our speakers address the role of AI in disaster preparedness and response? And what are the pros and cons of using technology in that space?
Yeah, I'm happy to jump in because this comes up a lot, as you can imagine. I've seen AI. So, first and foremost, when you have a large computational problem, AI is a great resource for that, right? For creating insights. Whether it's on a technology, I've seen like earthquake detection equipment or early warning systems that can detect I forget the waves that precede the actual shaking, but to filter out false positives and the use of AI within that, the hardware itself, to help differentiate between false signals and also increase the reaction time. Quite impressive, right? We've seen it in terms of large data management problems, as well as to kind of explore different outcomes and different simulations. Very, very effective. Here's where it starts to fall short on two levels. One is disasters or tail events. So if you look at a normal distribution of stuff that happens, and in the middle is where there's a lot of data, disasters, even with increasing disasters, are on the tails. They're inherently rare events, which means there isn't a lot of good training data. And AI kind of sucks when it comes to tail events. And so if you're looking for something that is heavily reliant on insights from those tail events, or from areas where data is not available to train it on, it may not be as effective. It may send you down the wrong path. And the other is you actually need people trained in how to use these technological tools. So there was an example of a system, and there was kind of a smear piece that a journalist wrote about it that was using AI to help fill in the blanks on like, well, if you don't have the sewage maps, we can infer where it is. And in some cases it was wrong. And population. So it said, oh, well, there's nobody living here, so it's not high risk, but it was a shopping mall because it was pulling from census data. So the emergency manager was saying, this is worthless. It's like, well, as an emergency manager, like the AI is not going to do your job for you. It's your job to figure out what it's telling you and what it's not telling you. So this competency with technology, this competency with data systems, and I'm not trying to say that emergency manager was incompetent. What I meant before is that this is part of the core competencies, is these are new skill sets that we have to bring to the job that we didn't have before. AI can be an important extension of our thinking, an important extension of our analysis, but it can't be a replacement for it. We still need that intuition. We still need to know where the gaps are in the data. And if something doesn't feel right, we need to use a technical term, to call bullshit on it.
Yeah.
Yeah, Zach,
Yeah.
if I could add, I think emergency response is a very human centered role. And I'll give you like when you're dealing with somebody who's maybe had a family member that was hurt, or God forbid killed, or they've lost their lifelong possessions or lost their home, that's a very much a human to human interaction to give them the best support that they need. So I don't think we should ever lose that. I hope we never lose that. I do think there are some potential roles that AI could help and support. Like an example could be, we saw all kinds of pop-up food banks, pop-up locations where services were being provided, like local faith-based community. And they may be moving from place to place, week to week, and their hours may be changing, using AI to help verify location and time, and things that are changing, I think may be a good use case for something like AI. But as far as like the coordination of what's happening, I think that's got to be a very human-centered approach. And I think Jeff answered kind of the other ways that you could potentially use it. But I don't think you can ever replace the need for people to be playing the most vital key role in emergency response and even preparation.
Yeah, it also, I think, can be really useful in the paperwork. There's as many as 90 or more federal programs across 30 different agencies with different requirements. Now these regulations are publicly available, but you have to find them in all these different places. So these are other issues too, where there's a large administrative burden. Or in designing exercises, you still need to have the planning meetings, you still need to build the objectives, but you can sort of shortcut a first draft using AI to kind of build out the exercise plan. You still have to do your job in terms of figuring this out, convening with people. It doesn't replace that, but it can save you a lot of hours to better spend on things that AI can't do or shouldn't do.
Awesome. Yes. Thank you both. So we're coming to a close here. So I just wanted to, quickly say thank you both again for your time. It's been such an interesting conversation. So nice again to see you, Jeff. We used to work together. But really thank you for all of the audience participation and the questions that were sent. So we know that there's some questions that we weren't able to get to. So if we will be sure to follow up on any of those. And if you have additional questions, please feel free to reach out to the amazing team working to support this webinar. In a second, if you're on a computer or a laptop, or I guess even on your phone, you could screenshot it, but you can scan the QR code with your phone to get in touch with Unite Us directly. Or if you prefer, you can visit us at uniteus.com/contact. I really hope that this webinar has been informative, right? Like I think it is an interesting space for technology to come into to improve that community connectedness. And again, we'll be sending a follow-up email just with that webinar recording. So if you are interested in connecting with us, feel free to continue that conversation and reach out to us via the website. So thank you both, and thank you everyone that was here, and have a great day.